Welcome, dear listeners, to another episode of Vet Neurojar, the podcast where we delve into the fascinating, sometimes perplexing, world of veterinary neurology. Today, we have an extraordinary case to share, a story that highlights the complexities of neurological conditions and how they can manifest in our beloved animal companions. We're diving into the case of a 15-year-old domestic short-hair cat, whose journey took some unexpected twists and turns. Our story begins with a seemingly simple complaint. The cat's owners noticed that their feline friend was experiencing increasingly frequent episodes of what appeared to be vestibular disturbances. These episodes were characterized by a cluster of disconcerting symptoms, a noticeable head tilt, involuntary rapid eye movements known as nystagmus, an altered mental state that included disorientation, and vocalizations that suggested distress. There was also excessive drooling, restlessness, and even vomiting. What was particularly puzzling to the cat's family and the veterinary team was the sporadic nature of these events. They lasted less than 60 minutes, and in between these episodes the cat appeared completely normal. Initial veterinary examinations, including neurological assessments, blood pressure readings, and even basic blood work came back normal. The primary care veterinarian prescribed treatments for nausea and motion sickness, but the symptoms continued. The cat underwent a variety of diagnostic tests, including thoracic radiographs, which showed only minimal changes in the bronchioles of the lungs. Even after being treated with antibiotics and anti-nausea medication, the episodes continued. Further blood tests, including thyroid and heartworm tests, also came back normal. The poor cat was also given fluids to treat dehydration. This cat's strange symptoms stumped the initial veterinary team, and the cat was eventually referred to both a neurologist and a cardiologist. An echocardiogram came back normal, and the cat was put back on anti-nausea medications, antibiotics, and anti-motion sickness medication. However, the unusual events continued to occur. The frequency of episodes increased to as many as 10 events per month. Videos recorded by the owners documented these episodes. The videos were crucial in helping the neurologists characterize the unusual nature of the cat's symptoms. The videos showed a left head tilt, and the nystagmus was primarily horizontal, with the fast phase moving to the right. Interestingly, one video showed similar head tilt, but with the fast phase of the nystagmus moving to the left. Other reported signs included abnormal mentation, vocalizing, hypersalivation, restlessness, and vomiting. Given the cat's peculiar clinical picture, with its mix of vestibular signs and other neurological oddities, the veterinary team suspected there was an issue with the vestibular system. However, the specific cause remained elusive and further investigation was clearly needed. 1 month before a scheduled advanced neurodiagnostic workup, the cat experienced another episode. This episode included several hours of variable ataxia, nystagmus, stumbling, and an altered mental state with a normal inter-episode behavior. A pre-anesthetic blood pressure reading was elevated, and with that information the decision was made to proceed with advanced neuroimaging. A magnetic resonance imaging, or MRI, scan of the brain revealed a crucial piece of the puzzle. The scan showed a small, well-defined mass in the left temporoparietal junction area of the brain. This mass was consistent with a meningioma, a type of tumor that arises from the membrane surrounding the brain and spinal cord. Importantly, the MRI showed that the structures of the middle and inner ear, which are typically implicated in vestibular problems, were perfectly normal. A few days after the MRI, the cat was hospitalized again due to severe diarrhea. During this hospitalization, the cat had 2 very concerning episodes, which further suggested seizure activity. The first included a sudden onset of vomiting, hypersalivation, an altered mental state, and a strange stargazing behavior which resolved by itself. The second episode was triggered during a fundic examination, when a bright light was shown into the left eye. This incident provoked projectile vomiting followed by the cat going rigid, with opisthotonus, a severe arching of the back while vocalizing, collapsing and foaming at the mouth. Fortunately, the episode was interrupted with intravenous diazepam, which helped the cat regain a more appropriate mental state. Given the cat's seizure-like activity, the veterinary team initiated treatment with intravenous fluids, B-complex vitamins, the anti-seizure medication Levetiracetam, famotidine, Maropitant, and metronidazole. It was noted that the cat also displayed persistent, mild symmetrical mydriasis, or pupil dilation, with incomplete response to light during this period of hypotension, but that this was considered to be likely due to a pre-existing condition. The cat was discharged home on oral versions of these medications and a special diet, and thankfully did well. The next step for the cat was a surgical procedure to remove the meningioma. A craniotomy, an operation to open the skull, was performed to access and remove the mass. The immediate post-surgical period was initially uneventful. However, the cat experienced an episode of right head turn, nystagmus, and unresponsiveness later that same evening. This episode resolved spontaneously and a subsequent episode was interrupted with diazepam. The histopathology, or microscopic tissue examination, of the removed mass confirmed the diagnosis of a meningioma with a low mitotic index, meaning that it was not a fast-growing or aggressive form. The cat's recovery went well, and there were no further episodes for the next several weeks. The cat still had mild mydriasis with incomplete pupillary light responses on repeat examinations. The prednisolone that was administered post-surgery was eventually tapered down and discontinued. Importantly, the anti-seizure medication, Levetiracetam, was discontinued about 3.5 months after the craniotomy. Unfortunately, the cat had 2 more brief, 10 to 15-minute, episodes, once about 4 months after stopping Levetiracetam and the second around 9 months after that. Between these episodes the cat seemed entirely normal. The cat was eventually euthanized due to an unrelated, but painful transitional cell carcinoma of the bladder about 2.5 years post-surgery. This case is particularly significant because it suggests the cat was suffering from a condition called vestibular epilepsy, a rare type of epilepsy where seizures manifest primarily as vestibular symptoms. These symptoms, like vertigo and nystagmus, are typically associated with inner ear or brainstem problems, but here they were linked to a lesion in the temporoparietal area of the brain. In humans, episodic vestibular signs are categorized into spontaneous and triggered forms. Spontaneous forms can include vestibular migraines, Meniere's disease, transient ischemic attacks, epileptic vestibular aura, and vestibular paroxysmia. Triggered forms include benign paroxysmal positional vertigo, orthostatic hypotension, and panic attacks. The cat's clinical presentation included many features that made the veterinary team suspect true seizures: short duration, a normal state between episodes, altered mental state, hypersalivation, and episodes that occurred during rest or at night. The bizarre signs like a head turn and foaming at the mouth were also not typical of a simple non-epileptic vestibular disease. In addition, the positive response to Levetiracetam and the improvement after the meningioma removal further supported the idea of vestibular epilepsy. When looking at human cases of temporoparietal occipital junction epilepsies, many of the symptoms are similar to those seen in the cat: nystagmus, nausea and vomiting, a feeling of epigastric rising, which is like an upward surge of sensation, variable abdominal pain, hypersalivation, a head turn, and an altered mental state. Some of these epilepsies can even be triggered by flashing lights. While EEG recordings are typically used to diagnose seizures, when that isn't possible, a presumptive diagnosis is made by ruling out other causes of vestibular syndromes and assessing the response to anticonvulsant drugs. There are some limitations to this case study, since an EEG was not performed. It is possible that the symptoms may have been caused by transient ischemic attacks related to the tumor. Similarly, the swelling and edema around the tumor could have affected nearby structures. It was also not possible to completely rule out inflammatory encephalitis without a spinal fluid sample. In addition, the cat's severe bout of gastroenteritis and associated symptoms further complicated the diagnosis. While the symptoms were assumed to be unrelated to the tumor, it cannot be ruled out that they were not somehow all related. However, the persistence of episodes with a lack of any progressing disease between the episodes suggests that an ongoing active infection or a systemic cancer are less likely. Ultimately, the diagnosis was based on a process of elimination, the characteristic nature of the episodes, a positive response to anticonvulsants, and the cat's improved condition after surgical removal of the tumor. The tumor's location in the temporoparietal junction is consistent with the human literature on vestibular and autonomic seizures. This case serves as a vital reminder of the importance of detailed clinical observation, meticulous diagnostics, and the ability to think outside the box when dealing with complex neurological presentations. It also underscores the importance of considering rare conditions such as vestibular epilepsy, when more common causes have been ruled out. The cat's story has expanded our understanding of neurological conditions in cats, and it may help veterinarians and pet owners better navigate similar situations in the future. And that's all for today's episode of Vet NeuroJar. Thank you for joining us on this neurological adventure. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.